It's not something everyone's familiar with, and we're trying to get the word out. So we're doing a series of these presentations about doula work over the next several months. And thanks to Cook County Higher Education, we will be doing them online like this, so people can join from wherever. And we'll take your email and add you to our list to make sure you hear about those as well.
I would love that.
Great. On the call with us today are actually two other of my colleagues. If you can believe it, in this small little community of 5,000, there are actually 4 trained death doulas. And so I am one of them. Jean Skeels is on the line with us as well. And so is Margie Nelson. And the 3 of us work with another colleague, Suzanne Sherman, who happens to be in Africa right now doing vacation type stuff. Yes, lucky her.
Yes.
Lucky her. So
that's awesome.
I will tell you that the reason I became a death doula is because a couple of years ago, I was, forced is the wrong word, but I became involved in an end of life situation with my, both my mother-in-law and my daughter-in-law. And I found out, like, you know, in your heart of hearts, that I am really good at this work. And subsequently, I found the Anelda class, took it, came back here, and then found that, wow, Jean Skeels was moving here, and I'm going to let her tell you a little bit about herself, and then she'll introduce Margie.
Hi, Natasha and all. Yes, so I'm Jean Skeels. I came to this work over a interesting and very long journey that I've had around death and dying. And I can talk about this more later, but I actually suffered from extreme death phobia for quite a number of years and had to work really hard on dealing with that and learning how to be with this extreme fear of death that I had. And then I found yoga and I started doing spiritual practice. And what really brought me though to this doula work is I had over a number of years, quite recently actually, what I call my initiation into grief. And that was a few people who were very beloved to me dying in very quick succession. And then I found out about death doulas, and something in me, again, it's a similar thing. Something in me just knew that there was a calling there for me. And so that's how I came to this work, and I'm happy to be here with you. And I will pass you off to Margie.
You're on mute, Margie.
You'd think we'd remember at some point. It's been what, 2 years now? I think what you gals are saying also, it was a lot of personal experience. Somehow, I used to live in France for a long time, and I would go back almost every year. And almost every year, like, somebody was dying or somebody had just died. And it really touched me. I really wanted to be there. One of the things that I do as a body worker, and just that touching and that soothing, it really called to me. And so I just want to be available and hold space for people through that process.
I love that.
And Pat, did you introduce yourself?
I did. It's worked out. It's worked out very well for us as a team, Natasha. COVID, of course, has put a big kink into how we would like to do our work, but we are continuing to try to do a lot of education and to be available as we come out of COVID. So one of the things we have learned as a team is that in order to get our heads into this space, we typically try to do some kind of centering exercise. And our guru for that is Jean. And Jean is going to just start our process today with a quick little, I don't know if it's quick, but with a great little meditation. Go ahead, Jean.
It won't be long. And I need to preface this by saying that sometimes a component of meditation is to know that there's some disturbances in the background and hearing them or sensing them and letting them go. And I say that because I have construction going on in my house, and he just walked in and my dogs are on the verge of doing some harmonious barking for the background for this meditation. Meditation and breath work also, I just want to say, is also a component to doing death doula work. So when we're working with a person, if they're experiencing some anxiety or some emotional turmoil or whatever it is, this is a tool we use in our work, and we use it in all of these containers that we find ourselves in, because it helps us to open our minds, settle in, and be present. And presence is one of the most important qualities that we want to cultivate and we want to offer. That said, I would just invite you to make sure that you feel comfortable in your seat, that if you're in a chair, your feet are on the ground, if possible, that you sense your weight dropping into that chair, and you can either soften your gaze, or I invite you to close your eyes. You're arranging your hands in your lap or on your legs in whatever way feels comfortable. Softening your face, your jaw, your brow, and noticing your breath, and drawing your attention fully and deeply into watching your breath as it comes and as it goes. And if thoughts come in or bubble up, don't judge them. Just simply see them and acknowledge them and let them go, and come back to the breath, to this moment. Notice the quality of breath, that on each inhalation now, observe how the breath sustains you, it fills you, it lifts you. And on each exhalation, you can again soften and relax the body and let go into the ground beneath you. That every breath shows you how you are held and nourished, and every breath shows you how you can let go. Letting go of anything in the body that feels tight. Letting go of anything in the mind that feels tight. And allowing the breath to ease and soothe, to bring presence and peace to this moment. And as you feel that now, open your heart. Breathe into your heart and welcome the qualities of compassion, love, softness, witnessing, and being. And we'll stay here for a few moments of silence. Now, continuing to notice your breath and your heart and your body, expand the tenderness and light and love in your heart, and see it and witness it flowing out from you and encircling all of the people here in this meeting, and then outward even beyond that. For a few breaths, just see what we've created here and send it out into the world. And then when you're ready, you can begin to slowly open your eyes. And I welcome you back to this room, to each other. And I'll be giving it back to Pat.
Thank you, Jean. When I was opening my heart, I was also found myself smiling. That was a very profound thing we did, and I appreciate that. Jean and I are going to be going back and forth among our slides today, but we certainly, because we have such a small group, welcome any comments or questions as we go along. And we do have spaces built into the presentation for questions as well. So moving ahead, I would just like to open this by saying I find the need to do any kind of work like this much more important since COVID. I think that COVID has isolated, and of course, there's all kinds of facts around this. We've all read about it, but it has isolated us and it has caused people who have died during COVID to have a very isolating death without the privilege of having their family around. And I think that has brought on an entirely different type of grief to all of us for a number of reasons. So I find the work that we're going to continue to do going forward even more important since COVID has happened, because it's going to help us, help our community connect with one another again. The doula movement is not new, although it certainly sounds new to many of us who live in the Midwestern states. Birth doulas have been around forever. And we here in Grand Marais have a birth doula group of people who have worked with our expectant mothers, because Natasha, you might not know this, but here in Grand Marais, you can't give birth at our local hospital. You actually have to travel to Duluth, because we do not have enough births here to keep our practices relevant. So we have some doulas here who practice birth doulaing and work with our expectant mothers, and it's a very vibrant practice. And that goes back a long time. Death doulas are really a little bit newer than the birth doula movement, but they too have been around in countries outside of the US for many, many years. Companioning people through the end of life is not new, but it is something that we in America, or the Americas, have just recently discovered in the last 30 or so years. So we keep referring back to the fact that whether you're coming as a baby or going as a person going to death, there's lots of reasons to have loved ones and companions around you. And that's one of the things the doula movement does. So what really is an end-of-life doula? As I just said, it's modeled on the birth doula concept, but really what we find most important is being able to provide that emotional support that people need at the end of life. Typically, it's probably the first time the people surrounding the person who is dying is going through this. People don't know what to do. They don't know how to react. They don't know if their actions are right or wrong. There's just so many unknowns. And what the doula can bring to that process is work with not just the dying person, but work with the whole family. So they understand this can be an interactive solution based on what the dying person wants. It's not what the medical profession wants. It's not what the loved one wants. It's really what is the thing that the things that the dying person wants. That's the most important thing. We work very hard to find that out. Then we work very hard to make sure the family is on board and appreciative of that. And as we go through the process, we keep that focus going. And then after the person dies, we certainly are also around for working with them in the early grief stages and making sure they connect with the kinds of resources that is most important to whatever they're going through at the time. So really it's emotional support. It's not medical support. And that's what we're trained to give.
I love that.
I do too. But really, what is it that the dying person experiences? And Jean's going to take us through this.
So the slide here tells us a key point, that dying heightens fear of the unknown. And if you look at the bullet points we have here, these all can be or might be true, and any person might experience some or all of these, especially as people near the end or are actively dying. This turning inward becomes more and more profound, and their world becomes smaller. So as they get towards the final stages of this journey, there's a lot of introspection. There's a lot of looking at unfinished business and close relationship, and really assessing what and coming to a place of meaning making, as in what have I done, what's been important, and most of all, surrounding themselves with that inner circle of people. The question, have I made a difference? These sorts of things really do come to the forefront. And fear and wonder. This in particular, in my experience, can be affected by a person's spiritual life. And that's not necessarily whether they had religion or not, but whether they have a sense of a bigger power, a larger container. And it's never too late to begin to feel that. I mean, even right at the end. So, and it can help to assuage intense fear. Sometimes, maybe. Everybody's different, and everybody's going to have different things in different moments, and it can shift and change at any time. And then again, a time that one turns to that bigger presence. And like I just said, I've been with people who had a long time religious faith, and that was a great thing for them. And I've also had relationships with people who found that fairly recently because of this journey. And sometimes they just come to it as a sense that they're moving towards something else. The fear piece of it definitely applies to the person who's dying in certain and unique ways. Again, everybody will be different. But I just want to touch back that this fear sometimes can be greater for the people around the person. And certainly it's a greater thing for our society in general. As I mentioned, I suffered for quite a number of years with a severe phobia, which coincided with a postpartum for me. I had just had my first child. So it was an interesting thing that I think it was both of those things, that I'd had a child and then I attended a funeral, and all of a sudden I found myself in this really extreme state of fear. And I would say, I guess, I mean, I'm nobody offered this to me. I came to this on my own, that it was probably a postpartum depression that exhibited itself in this way. But the point is that there's a lot of people in our society who, whether it's like what I went through or just a general taboo around death, and the very natural and universal experience that people have in this fear of the unknown. And so as we've experienced in our death cafes and different things that we do, that's fear we address with people who are dying, but we also address it with the people around them and our community at large. So we can have a discussion. I've talked a bit about my fear of death. So the questions are you afraid of death, or what do you fear? And is anyone here not afraid?
I find it very interesting in reading and learning about this experience that at least 85% of the people in the US are afraid of death and don't want to talk about it. It is the prevalent notion, and in my opinion, it's because so many of us don't know.
Yeah.
We don't think about it. We don't know what's going to happen. We don't want to face it. It's like, let's put on the blinders, and at the end, that leaves us in a position of what? Fear, not knowing, being scared.
But how would you combat that? I mean, it's in my the way I think about it, there's either like it's unknown, and then I'll just find out when it happens. And when I die, I won't miss anything because I won't know about it. So that's how I think about it. I mean, I certainly don't want to die, but I don't think I'm afraid of it. Interesting question.
Yeah, I think it also depends on like, there can be a painful way of dying, and like there's so many unknowns, like you said. I mean, are you in pain when you die? Do you have control over that pain? Some people have that plan in place to where they are given medication so that maybe they don't feel that pain. Or is that pain that you're afraid of leaving those you love behind? Or maybe you're afraid of dying alone. I mean, I feel like there's so many unknowns that it's almost numbing. I don't know if I feel afraid. I think that the afterlife, and everybody has their own views. I mean, I do think that we reconnect with our loved ones, and I feel like that part isn't fearful, but maybe the leaving the loved ones behind, or maybe the fact that maybe you didn't get to do all the things you wanted to do. There's so much.
There is so much. And I think the older I get, the more I think about dying. I don't think I gave it a single thought prior to the fact that, I turned 70, and then all of a sudden I realized I might only have 20 years left. That's not a long time. And so it's caused me to think much more about death. But I think, to Karen's point, I'm finding that the education I'm doing and the information I'm getting about how I can prepare my loved ones, and perhaps leave some kind of legacy behind where they can remember me in whatever way I want them to. Excuse me, I should have turned this phone off. And I think that is helping me face the end as well. But
Sure.
It's still a little scary.
Yeah.
I think Natasha pointed out something that's really relevant, and that is I think, and I've seen this, that many people, if you really get down to it, their greatest fear, not their only fear, but their greatest fear oftentimes is that fear of suffering, that it will be painful and it will be long, and other people will suffer because they're in pain and having to take care of them. So that's a very relevant point, and it does happen a lot. That is a great fear for many, many people.
I thought it's interesting. When my dad was dying, it was so evident that he didn't want to talk about it, and I hadn't had this desire to be around people that were dying yet. And I think I was very in my grief to really push to acknowledge that with him. But his only concern was, how were we going to live without him? And we were very lucky at the TCU that we were at to have this, and I don't even know her role, and it kind of was like a doula in a way, because she just kind of sat and talked with him about his emotions. And I remember her coming down and just telling my mom and I that you just have to remind him that he taught you to be strong, and that you'll be strong. And I thought it was just such a prominent thing for me to just know that, like, it's going to be hard, but to be strong for him, so that he wasn't fearful of that. And I was totally okay with taking that fear on as much as I could if it just alleviated it for him. So I don't know, I guess I don't know where that fits into our discussion, but it's just something that's always stuck with me.
That's a powerful story, Natasha. I'm glad to hear it, because yes, the family can play that kind of a role when it's important to the dying person, and that helps complete the circle. So I'm sure that your father reacted well to that.
Yeah, he unfortunately he wasn't the same person being sick, so it wasn't totally him. But I think after that discussion, I think it did alleviate some fear, because he never talked about it again. And so, that was one thing that I feel like we didn't have to worry about, on top of all the other stuff. I mean, as far as now being out of it, like, he really didn't suffer, and it went very quickly. And I'm so, so grateful for that, especially when you see people whose deaths are very drawn out and they're not taken care of well. So we were very lucky. And so was he. I mean, it wasn't a I don't want to say a bad way to go, but that's kind of the words that
Sure.
are finding me, I guess.
Well, and that's what one of the core things that a death doula would do is have these kinds of discussions, is talk to people and try to uncover what are their needs and how can we meet them. And so what I'm going to segue to next is just some of the basics about dying and some of the things that come naturally with this role. And the first thing that we really do care to know is, where does the dying person want to die, and how does that dying person see the end? 85%, I have some stats here, I'll just give you, about 80% of Americans really want to die at home, and they just don't get to do that. Most people are rushed to the hospital, as you know, because you work there, at the end of life, and many people die in nursing homes. And a very, very few people get hospice care, which is what you really need to make sure that people are pain-free at the end of death. And here in Grand Marais, just so you know, in Cook County, just like it is for birthing, in order to use hospice, you really need to go to Duluth. So you can't die in your home. So that's really unfortunate, but a doula can help with that bridge here. We can be the one who can hopefully work well enough between the medical community and the family and the dying person to either allow them to die here at home or let them be here as long as possible. So we spend some time with the dying person, understanding where and what they want. We also hold a lot of space, because too often as family members, we just jump in because we want to help, and we do and suggest things that make sense to us. But what we do as doulas, especially if we get in earlier on in the process and the dying person is still able to communicate and tell us and talk to us, we really ask what the dying person wants, and we spend time trying to help them articulate it. We certainly in our training are appraised of a number of skills to ask open-ended questions, to do some visioning with people, but to really get their needs down and to document it, so that when the end comes and all of the drama and the emotion around it happens, we can refer back to something and say, but remember, Dad wanted you to do this. Or remember, Mom said, let's all sing hymns at this point in time, or whatever it is. But we can get that out in the beginning, and that really makes for a more meaningful experience as well. Some of the other things that are really important at the end, true, is what are the experiences that are surrounding this event? What are the sights that someone wants to see? Right now, is their bed looking at a wall and they'd rather be looking out a door or a window? Is there a certain scent that really calms them that they would like to have in the room that we could do with essential oils or with candles or with something like that? What are those things that are going to make this experience as comfortable as possible for the dying person? And again, that's something else where it has to do with sounds as well. Do they have music? Does it all has to be mournful music? Does it have to be exciting music? Does it have to be whatever? We document that. We work with the family and we try to make those things happen as well. Because again, if you don't ask, you don't know.
Yeah, it's so important in the hospital, and not in the ER anymore. Well, I try, but I'll put on like just soft music, something that, and it may not have been something that they would have enjoyed, but I try to make it as calm as possible. You try if you don't know. Yeah.
Yes. And you're probably doing you're adding something that was not there before that could be a calming effect. That's really important. Congratulations on doing that. I'm surprised they even let you, whoever the they is.
Yeah. It was nice. I did work for St. Joe's, which was a Catholic-based hospital before I was in the ER. And so they did have like a Christian station on the TV. That was really nice to have. And now where I'm at, that isn't really possible, but you still try to do what you can, whether it's, I've really tried to advocate on the floors of a hospital. You usually have like a comfort cart, and it usually has like water, coffee, or cookies, just something. And we don't really have that in the ER. And because of COVID, you know, we're so short staffed. We're stretching our resources so much than what we used to do that people are staying in the ER far longer than they should have. And I just think that we should have those resources, because maybe we didn't have a need for it before, but there's definitely a need for it now.
I'm so glad you have shared that with us, because that certainly makes us feel that what we're doing is right. And what we're doing
It is.
so great. Thank you for that.
I don't want to speak for Margie, but I would guess that she would probably include touch here.
Oh, sure.
So Margie, you have anything to share? Natasha, just so you know, Jean and I prepared this presentation because Margie's got is out of town, but we're glad she could join, and we want to invite her in.
Absolutely. Touch is so important.
You're on mute.
I think it's also important just that you talk about it, or you suggest, or you put on the music, even if it's not well received or you don't have much of a chance. Every little bit is a little ping that the whole world around you is hearing. Oh, I never thought of that. We should get some music. And so speaking up and gently proposing things has large consequences in a good way.
Yeah, you know, we did not have a good experience with our hospice team when my dad was dying. I'm sure that's a big push of why I tried to probably do more than what I'm asked, but I would want people to feel safe and loved, and that their loved one mattered. We didn't always feel that way, and I just, you know, I think a big factor when grieving happens is everybody's there when it first happens. And then when it's done, for everybody who isn't, you know, immediately touched by that grief or that loved one dying, they go back to their normal lives. And yet that grieving process is still very, very real for the people closest to that loved one. And it's just so important to whether you're checking in with somebody and just say, hey, I'm thinking about you. If there's anything I can do to make this easier on you or take something off your plate, is just so important. And that goes well into just showing up and maybe turning that music on or holding their hand, all of it.
Oh, you're so very right. What I suggest in my family that we do is send cards 3 to 5 weeks later, not right away, because it's then that people are feeling alone and isolated. I lost a baby, and nobody knows what to say when something like that happens. And I spent the next 3 or 5 weeks at home, not working, because I had some leave time. And I saw no one talked to me, no one said anything, because they don't know what to say. And that made the grief even worse. So you're right on with what you're talking about, and you should preach that. Preach is a strong word, but you should
I like it.
share that thought with as many people as you can, because I think we all have to pick up on it. It's a really important point.
Absolutely.
So besides that, we also want to make sure we're thinking of not just the dying person, but the family. And we want to do some reflection with them. And Jean, you're going to talk to us about this.
So these are some questions that we might bring into our relationship with the dying person and their family. Of course, we're always centering our attention on the dying person. But as Pat has mentioned, the dying person isn't having this journey all by themselves. So their friends and their family and their community at large is important. But in terms of environment, we work with them to define what their ideal scenario is. And if we can create that, we do. So we've already mentioned this. Where do they want to be? What's there? Who's there? Do they want pictures, books, music, all of these things, religious elements, or maybe they don't want that. It can go either way. So we really need to listen to them. And, you know, it's not about us or controlling the environment. We need to hear from them exactly what it is that they want. What do they want to view? Pat mentioned, do you want to be looking out a window? Me personally, if it's possible, I want to be outside under the sky and by a tree. But you know what? The best laid plans also might get complicated. And so that's an important thing to remember too, that when we devise these things with people, we also let them know that we will do our very best to make that happen. And sometimes it can't work for whatever reason. Rituals are important. Maybe or maybe not to that person. Again, it's about them. So if they have a religious background, they might want something in particular. If they're not sure, we can certainly like say, well, so-and-so did this, or sometimes people like that. But again, it ends up being entirely up to them. This point about thinking of your life story is really such an important thing for people to do. To get closure, to identify the things that maybe they need to say or even do to have a sense of completion. And as best as we can, bring them to a place of peace. And to help them identify where the meaning is in their life, so that if there's something they still want to do or create or say, write letters. We do legacy projects with people. I'll give you an example. I worked with a woman, and what we ended up doing was making a cookbook of family recipes, because the greatest source of meaning in her life were family gatherings where she made these family recipes. And so there's things like that that we help people identify, define, and help them create for legacy. And then what values or truths do they want to tap into or express or have as a foundation for their dying process? These are all important things that we consider, and we work with the person, and again, the people around them. Anything to add, Pat?
Oh, I do have something to add, and I'll just go back quickly. It's just not rituals for the dying person either. Let me share with you something that has haunted me since my mother-in-law died. She died at home. It took a long time for the funeral people to get to us to remove the body. And although her son, my husband, and her daughter spent time in the room with her, we could have been doing much more as a family together around the body. But the thing that haunts me most is seeing the body come out of that bedroom in the black body bag, and then taking her out of the door. And I would tell you, since I've been involved in this work and I've been learning from so many people, had I to do it all over again, she had a favorite quilt. We could have covered the bag with the quilt. It could have been a much warmer scenario, much more meaningful to the family. I didn't even know about stuff like that. So rituals like that is something that we would share as well with the family, so that they can think about what they want when it's no longer about just about the dying person.
It's interesting that you share that. The nursing home that my dad ended up being in, they had a special quilt, very soft and beautiful, that they did put over the bag. And then he hadn't been down there long, so he really didn't know very many people that lived there, but they all came out of their rooms. They lined the hall. We sang a beautiful hymn, and then we got to walk out after with the body. And it was a very beautiful thing. It wasn't, I would have never thought to even do something like that. And I'm so grateful that they did think about it.
Yes, and I'm so glad you shared that, because it just makes the hair in the back of my head stand up. That's one more piece that would help everyone in this situation.
It's
And
nice
even
though,
though-
because, oh, go ahead.
No, you go ahead.
I was going to say it may have been a hard lesson, but at least sometimes we have to learn the hard way, right? So like it's a memory that you don't love, but like now you get to fix that for other people, and that's so beautiful.
Yes, thank you for that. That makes me feel a lot better too. That. Margaret, do you have anything you want to share
No,
here?
no, that's good. I agree.
Okay, great. And
So
then
me? Yeah. I'm going to continue and talk about the emotional needs of the dying. So when a person is dying, they will often have a wide range of emotional experiences. And just as I mentioned before, these can change and shift very quickly, and many things can be held all at the same time. So we have a few examples of emotions that people might be experiencing. And by the way, this is also, again, not just that person. They're also impacted by the emotional experiences of those that are surrounding them. And so there's an interplay that happens. But we mentioned, of course, fear, denial, regret, anger. I'll come back to that one in a moment. Depression, guilt, resignation, acceptance, grief, humor, and more. I would also add to this gratitude, joy, spiritual connection. I've seen all of these things. And I mentioned anger. So there's a woman that I worked with as a doula volunteer for a hospice in Maryland who is incredibly still alive. But she's not doing well. And she called me yesterday and said, I just needed to call you, Jean, because I'm feeling so much anger today. And she said, I just am so angry with God, and I'm angry with my mom, and I'm angry. She went down a list of all the people, and she mentioned God several times. And I just, so our role as a doula, and I'm also now friends with her, but in this moment, I'm her doula. And I just listened, just sat and I listened and I said, I understand, and it's okay. And of course you are. And she just talked and talked. And at the end, all I had to do was say, I understand, and it's okay. And I'm here, and you're, it's reasonable. You don't have to feel guilty about that. People get angry. And she started, the pace of speaking and the tone and everything just started to change the more that she talked. And finally at the end, it was like, wow, I feel so much better, and thank you for validating me. And really that's what people need, and that's what we're here to do. We're not here to fix or change or move somebody out of a state or tell them that they should be or feel any way at all. That all of this is valid and real, and it's okay. And it's okay. Yeah. Reminiscence, we've talked a little bit about that, and it does become very important. That life review, looking back on what's been joyful as well as sorrowful, what's been the great pinnacle of what they feel they've created, and things that maybe they have some regret around, or wish they would have done. And relationship becomes very important in that. Have I said the things that I need to say? Is there a conflict I would like to try to resolve? Many different sorts of things with family, friends, and community can be part of this reminiscence. Communication, I just mentioned, non-judgmental listening and validation. There really sometimes is nothing more powerful for a person than to just be able to speak, to say the thing that they think is unspeakable, and know that there's a container there of non-judgment. And finally, contact. And this is where, as doulas, we do a lot of bridging work. So we act as a bridge between the person and their family, a bridge between the person and their friends, maybe a bridge between the person and their religious community, whoever it might be. So that if there's something perhaps that they feel uncomfortable saying to a family member or a friend or whoever it might be, we can either assist them in formulating a strategy or a way of saying it, because sometimes they just don't know how to say it and they don't want to hurt people or create a deeper conflict. Or with their permission, of course, always with permission, we can sometimes bridge that gap and reach out to that person for them. But that has to be very clearly stated, and we have to have really clear understandings about boundaries and where we can go and where we can't. But this is a very fundamental component of our work, is this exploration of emotion and supporting people's emotional journey.
And I would add, as we talked to particularly family members about this, and this was very evident in the second death that I witnessed. You know, I'm an obituary reader, and you consistently read about how someone died peacefully, surrounded by friends and family. And that's not always true. In one of the cases I had, my mother-in-law, who never said a swear word in her life, cussed me out for like 2 hours in some kind of crazy emotional situation she was in based on the drugs she was having and the fact that she was dying and everything like that, and took me completely by surprise. I mean, I didn't know what to do because I've never seen it before. And so that's another thing that we can do when people talk to us about what their expectations are, is help them set them that things might not be all peachy keen.
I love that you say that, because even though my dad was not verbal, he made some very frightening faces. And he was not the first person I had ever seen die, but the first person I had ever seen not die peacefully. And not that it was bad, it was almost like he was fighting to stay here and then he let go, which in hindsight, now that I can digest it, I get. But for somebody who was unprepared and for somebody that was so close to me, I do wish somebody would have prepared me for that. Maybe not had, you don't have to just say this is what's going to happen, but just an idea of like, it could not be peaceful.
Talking about the variety of emotions that might occur
Yep.
is something that is really important. I honestly believe that after having experienced what I did. And so that's another one of the things we do. And
I
it
love
all
that.
goes back to having that open, honest communication with
Mhm.
everyone during this process.
I also, one of you just said something about fundamental. And first you said fun and then fundamental. And I think, but there's fun too. Can you all
Yeah.
get a laughing jag about what Tommy did when he was 5 and, just not feel that that's sacrilegious when someone's dying, to bring in some fun.
Yes,
Can I share a funny story?
Yes.
of course.
So the hospice nurse did share that we should get my dad's fingerprints, and we had bought some ink, and we were caught off guard the day that he was actively dying, and so this ink pad was not working. And here we are trying with my dad's giant hands, and he kind of had a big belly, and we're like digging his hands with like in the ink and then putting this paper on his belly and trying to like push these hands on to like make these imprints, and it wasn't working. And my very sweet husband even went to the police department to see if like they had ink that we could use. But it was just, we all kind of stopped and laughed, like, he's actively dying, and here we are with our dad like putting his hands in ink and pressing on his belly, and it was like not working the way we had imagined it would work. But and we know that like he would have been laughing about that too, because that's just who he was. But it was just like this moment where like it wasn't sad, and that because my dad loved to just be around people and have a good time, which is how I am. And so it was just like a funny moment. But I'm glad you shared that, because it is important to have the cries and have the laughs and the memories and maybe the not good memories and the music and all of it. You know, I was so happy that even though maybe my dad and I didn't talk about death, my sister and my mom, we could all talk about kind of what to expect. And so we all knew to be around him, but also to leave the room in case he felt like he couldn't leave us. And so that there was that open communication of what is it for him? You know, not just us, even though we were so in our grief, but what was it for him too? Maybe we couldn't be around him for him to finally say, yeah, I'm done, I'm leaving, you know. Just back to that communication aspect.
Now, that makes me think of another point to consider, and that is that as much as we might plan to be surrounding the bed of the person when they die, some people consciously or subconsciously wait until they're alone. And that can be really hard for family members who have had this idea and are there ready to hold their hand and be there. And some people, whether they've articulated it or not, do make somehow that decision to not have them there. It can go so many ways. And then there's people who will hang on because something in them needs that one person to get there. And then when that one person gets there, they come into the room and they can let go. We just can never know what is brewing underneath the surface for people, even as doulas. And when we've sat and listened and made the document and we, you know, they've told us the things, there can be things underneath the surface that will happen that they didn't say, couldn't say, or maybe didn't even know themselves.
Yeah, it's so true.
Exactly. So we transitioned this to our next slide, which really talks about the emotional needs of loved ones. And I started off with mine, but I think that we also have to think about what's happening with them, our loved ones, as they start this process. And Jean's got some ideas around that.
Well, I think I've mentioned a few things already. So again, this can be many different ways. Some people have a very close-knit family, and the process can be just about creating the ideal setting for them to be together and to have that container of love. And then sometimes there's surprises. There can be secrets. Lots of things can come up. And so again, our job is to listen with compassion, to receive whatever comes up, and as best as we can to try to negotiate closure and peace, because our business is called A Better Death. And that's what we're trying to create. But sometimes we won't be able to fix or cure or solve. And that's just true as well. It can be an easy journey with family and friends, and then it can be a difficult journey with family and friends. So my beloved Valerie that called me yesterday, one of her things was, so she lives with her mother, and her mother is a nurse, and her mother is also her mother. And she said, she whispered into the phone, because I think her mom was there, Jean, my mom is driving me crazy. I'm just get so angry. And I said, well, you know what, Valerie, your mom, and I said this to her, your mom has a dual thing going on here. Your mother is a nurse, and your mother is also your mother. And so trying to balance those two things that are such a big part of her life has got to be difficult for her. And I'm sure that that's coming across to you in whatever way that's making you angry. And I said, Valerie, I think the most important thing is that you just remember that however she's being with you that you can't tolerate or you don't appreciate is coming from love. Because I know her mother, and I know that that's where it's coming from. So I can say that to her because I've spent time with them. And she said, well, I know, Jean, but sometimes I just can't take it. And I was like, you know, I get it. So just as an example, and it can be so many different things that can come up. And Anything else, Pat, Margie, you want to say about that piece?
I don't think so. I think that what's important to me as to what you said, Jean, is that every death is different. And you can't move and think that this one is going to be like this, or there's a template somewhere. Every single death that I've witnessed has been different. And there have been good and bad things. As Jean said, yes, it can be wonderful, it can be bad, and it can be both in the same death, you know?
Yeah.
Just have to be able to be calm and work through these issues.
So when you say work through these issues and you're dealing with loved ones that have their own set, are you like, when you train to be a death doula, are you trained to deal with the loved ones? I mean, is it part of your job to help them with their grief? Or is that secondary to the dying person? I'm interested to hear how you manage like expectations or whatever.
Yeah, we here don't have hospice, which makes our role particularly more expansive, I would say, although we haven't had a whole lot of opportunities at this point to work with individuals. But I can say that when I was in Maryland and I was doing doula work for a hospice, that was different in that I did have the hospice as backup. And I did have some situations where I had to bring in the social worker. I had to call and say, you know, there's a situation here. But as far as us here, yeah, that bridging component is certainly a vital part of what we do. And we do have to be careful because we're not therapists.
Yeah.
We're not trained therapists. So we have to have a lot of discernment around what we can deal with and what we can bridge skillfully and within the scope of our practice, and when we need to pass them on to other resources or bring other resources in. I don't know if that totally answers your question.
Well,
but
I would add to that is that I don't think you're in this field unless you have a deeper sense of intuition and a deeper sense of being able to feel what's going on. So I've had a couple of situations on the shore where I've had family members that I have actually talked to outside of the dying room to talk issues through that they were experiencing and try to help them understand how to bridge back into the situation with their mom. But I do believe a lot of what we do depends on what's going on at that particular time and what I'm sensing and what I could just tell that will work or won't work. So I can't just say yes or no to these kinds of things. Every situation has been a little bit different for me. And sometimes, because I'm a caretaker, I might overstep my bounds because I care about everybody in the room and I try to not do that. But you know, you kind of know what is going to work and what's not going to work. I mean, we're trained in listening. We're trained in doing visioning with people so that they can understand. We can walk them through scenarios where they can finally see what their vision is. We've got those kinds of hands-on training that I think help in these situations as well.
I'll offer a situation that I had just to give another example of this. I was working with a woman in Maryland, the one with the cookbook. And as I worked with her, we gained quite a rapport. And the more time I spent with her, she started to share with me that there was a lot of family conflict. So my step one with her was to say, well, have you talked to it was among her children and her. Well, have you talked to them about it? Have you shared with them your feelings? So we talked a lot about that. Then I actually ended up talking to one of the daughters quite a few times about this conflict between the two sisters. And so I tried to help her, understand how mom was feeling and how we could keep that situation maybe a bit separate so that it wasn't affecting mom so much because it was really bothering her, and maybe the sisters needed to do some work on their own. But eventually what ended up coming out in a further conversation between me and the patient mom was that there was some physical abuse that had happened. And at that point in time, I had to go to the social worker. So I dealt with it up to that point of like trying to create some communication, trying to make it easier on mom, because she was the patient I'm working with. I'm there mostly to be there for her and to help her. I did do some bridge work between the sisters, but ultimately when that came out that there was a physical confrontation that happened with a punch, then that wasn't in my scope of practice anymore. And I had to bring in the social worker and let her deal with that at that point. So these are the sorts of things that we can have to make some decisions around and know what we can deal with and what we can't.
And I'll give you another more simple situation that happened to me. The person was dying. She was in conflict with her sister at the time, and the mom wasn't going to let the sister know that her sister was dying, her daughter know that her sister was dying, because we're just sure she wouldn't want her here. And I said, you can't make that decision for her. You have to, my counsel was, you have to let Julie make that decision for herself. That was a sister who was in conflict. You have to tell her. So, you know, we give that kind of advice out, whether people follow it or not, it's up to them. But sometimes they're just not capable of thinking through the whole circle of cause and effect. Very interesting. Do you want to talk
I like that you.
Oh, go ahead, Natasha.
Oh, I was going to say, I just like that you talk about kind of like a balance between the dying person and the family. I recently came across a gentleman who was a patient of ours that mentioned that he also was a death doula. He took like Susan O'Brien's course or something like that. And he really, I had mentioned just kind of along the lines of, I feel like not every, but a lot of the things that I come across online talks about kind of everybody's particular maybe interests when they do doula work, that maybe some people really enjoy helping people plan their funerals, or some people really prefer that grief process when helping as a doula. But he was like, oh no, we're there for the family. And I thought it was just, I don't know, I feel like there has to be a balance. I think that the dying process is so vast, and there's so many levels, like we had talked about, the anger, the grief, all the emotions, but it's not just the dying person. And sometimes the dying person is just so concerned about their loved one. I mean, I just really think that there has to be a balance. And maybe the family becomes more involved after that person has passed away, and we do spend more time in the grief aspect of it. But I definitely think there's a balance there that we have to hold.
That's very well said, Natasha.
Thanks.
Absolutely. So should I move on to anticipatory grief?
Yes.
So actually, I think I gave an example of anticipatory grief. So my beloved that I was speaking to yesterday, her mother, I think that is part of what's going on. So when people are in anticipatory grief, they know that their loved one is dying, and that grieving process starts to rise up and happen before the death. Yeah. And there's some things listed here that we can talk about in anticipatory grief: depression, extreme concern. It can be anger, agitation, preparing, starting to go through their belongings or thinking about organizing. There might, I don't have any proof of this, but when I think of that, you know, when women are going to have a baby, they sometimes go through this nesting, what people call nesting. And there might be an equal component here where people want the logistics in place and they want it to be organized. And that can be a coping mechanism for some people. adjusting to the changes that will be caused by the death. And
Mhm.
always this unfinished business component is often so important. And even if it's just the kind of cliche, make sure that you say, I love you. Like sometimes it's just that. And then sometimes it can be complicated things that happen in the relationship and letting go of resentment or forgiveness or a whole array of different things that can happen. But this again bridges us back to the family. So it is a balancing act. And a family member's anticipatory grief certainly does have an impact on the dying person.
I wish that was talked about it a lot more, the anticipatory grief. I found that on my own when I was just trying to like figure out how to grieve. I mean, just going through that process of like my mom's had a stroke, so like I took care of everything with my dad, and I was very lucky to be able to stay at the nursing home with him, but it took me a really long time to come across that particular term of anticipatory grief, and it is very real, and it should be talked about more because it is different than grief after somebody's gone, because you don't know how to navigate it because they are still here, and you don't want to put the sadness on that loved one of, I'm already grieving you, because you are, but you don't want to share that really.
Well, and if you don't realize that that's what's happening, you may think of it in another term. You may think you're just being really crabby, or you may take it out on other loved ones that are near you, or you may pull away from, your partner, and not even realizing you're doing these things just because you're anticipating that someone you love is going to die. So it can, if you don't think about it in those ways, you might be presenting it on other things that are making it even more complex and hard.
Sure.
Yeah.
That's so true.
That's really true. And I really go back to what you said, Natasha, a while ago about at this point in time, it's really important to say, I'll be okay. I'll be okay. There's a hospice book that we give out, and that's one of the final things that people like to hear. It makes them comfortable. You're going to be okay.
Can I add something to that?
Absolutely.
It's also okay to not be okay.
Yeah. And I think if I would have felt comfortable sharing that, I mean, I think in hindsight, like I knew I would be, there's a song that talks about this country artist losing her father. And in this song, she talks about how on all these happy days, there's going to be sadness, right? And there has been, there are things that I don't get to see him enjoy. I know he's still with me, and that's super great. I very much need that, but I don't get to see him enjoying those moments. And I think it should be phrased that way. Like, I know I'll be okay. It just makes me a little more sad, and so maybe it needs to be phrased that way more. But you're right. It is okay to not be okay. And I've shared that with so many people that close to me that have lost somebody. And I love that we talked about the validation, even the anger, just holding space for somebody to know that like the way you're feeling is okay.
Absolutely.
Yeah.
Good points.
And I'll just add to that. It's so important to know when we're not okay, because then we can seek help. Yes. There's so many people who try to navigate these sorts of things on their own, and they'll just figure it out, or it'll, and we need to also release the stigma around needing therapy or needing counseling or needing whatever we need, that we don't need to go that on our own. And it doesn't make us a weak or unstable or incapable person to know I'm really not okay here, and I need some help.
I agree. I love therapy. I think it's so nice to know that you have a safe, like we talked about earlier, that safe space of being able to know that it's not judgmental. And also just to have like an outside look of how can I navigate these feelings? because I'm not the professional, maybe, I'm not the professional therapist and I'm having trouble navigating these emotions. I need your expertise to show me how to get through this, how to move through this in a healthy way.
Yeah, I'll just quickly add that in Maryland, when I worked with the hospice, one of the volunteer roles I did was called bereavement calls. And so I'd have a stack of papers with people's names and numbers on them who had lost their loved one that was in the hospice. I think it was at regular intervals that you made those calls, and I did 2-week calls. And I just will say that it was amazing to me the number of people who I called, because I had a script that I read, and it was, I'm calling to check on you, ask some questions. And one of the questions was, do you think you would benefit from the grief counseling offered through the hospice? And so often the person would say, oh, I hadn't really thought about it, or I didn't know about that. And well, yeah, I do. I think I do need that help. But if I hadn't have made that call,
Yeah, they wouldn't have known.
they wouldn't have known. Yeah. So
I love that. Yeah, that was a big thing that was pushed when we did hospice. And although I didn't take advantage of it, I know that when my mom got those calls, it was the first time she acknowledged that she wasn't doing well. And so as somebody who maybe couldn't help her with that aspect of grieving, I was really grateful that that part of hospice existed.
yeah.
And that lets us transition really into what we've been talking about so far.
Well, I will read through this slide because I think we've already discussed this.
I think so a lot as well.
But so the listening and the support and the bridging, and above all, we listen. Again, we will just continue to emphasize.
But we want to keep emphasizing listening. And although we're a very small group and don't need to do it again, I think it's really important to keep talking about how important it is to listen, because most people don't know how to do that. They talk and they talk and they talk because they're concerned about answering right. So we emphasize listening a lot in our work. And then what happens when, and you've used the term already, Natasha, when people are actively dying, the whole concept of sitting vigil while a person dies is integral to the work we do. We don't want that person to be alone unless they want to, but we don't want that person to be alone for a single moment throughout the active dying process. So if it's going to be for a long time, we would work with other doulas, we would do shifts, we would do whatever, but we're there, even if we're just in the corner of the room, to make sure that what the dying person has said he or she wants is happening, so that we can be of service if there's something going on that we can be of service with. But sitting vigil is a very important process, because like the birth doula in bringing people into the world, we want to be there, hopefully with the family, in a supportive session, helping that person leave this world as well. So vigil can take anywhere from a few hours to a lot of days, but the active dying process is different for everyone. And so this is an important piece that we do as well.
I love that.
And then what happens after that? We just don't walk out the door. We are also trained to help the family for a small portion of time after a death. Like Jean said, we're not a counselor. We don't do grief therapy, but we can certainly make sure that we represent what the dying person wanted and what the family told us they wanted before this all happened. So if there's rituals, one of the things we talked about in my training, which was new to me, was that some families really want to wash the body after the person has died. That can be something that could happen. We want to make sure we address the specific needs of the family. You mentioned songs. I think somebody mentioned hymns, whatever it is that's going to help the family transition from the actual death to what's going to happen after that, we would be around for. So we would stay until the body is transported. We would be in contact with the family for a few weeks after that. We would see what's going on. And if we needed to refer, as Jean said, we could refer people to the right sources. If we needed to make suggestions, we can. But the important thing anyway, in my practice is, and we've talked about this too, is letting the family know there's somebody there for them, that we're there, that we're listen, that they have a touch point when all of a sudden they feel so bereft and alone.
Mhm.
And then I'd just like to talk a little bit about what happens in the course of this whole process. We look at ourselves as a group of people who can bring resources to the community. We'd like to get involved with people way before they're actively dying, so we can talk to them and set this up in a way that's very meaningful when they have time to think about it and choose. So because of COVID, of course, you know this better than us because you work in a hospital, we haven't been able to be there. We haven't had access. The family hasn't had access to be there in person. So we've been doing a lot of education. We have a Facebook page. I put out a monthly email update with information and resources. And the other thing that's been really powerful here in our small community is a death cafe. Once a month on the first Thursdays, we get together for an hour with anyone, it's Zoom right now, with anyone who wants to drop in and talk about anything. It's so important for people to feel they're not alone, that there is a source of support in the community, and there's lots of it, but sometimes it's just this little death cafe that allows people to come together, let down their hair, and feel really loved. And that's what Gina and I just did one this past month, and you just could feel the love with the group. It was a small group, but the support was there. And I think everyone left that meeting being able to go about their daily life in a little better spot. So
I'm really happy you shared this. I was actually the other day at work, I was Googling death cafes in the Twin Cities. So I'm so happy. And I didn't find any. I found some old ones from like 2013 that were scheduled, but nothing recent. So I'm super happy that you shared this resource.
yes, we have one. And when I send you my email, I'm going to send you one that I belong to that's down south. This death cafe has been going on for, I don't know, 8 or 9 years. There's a very core group of people, and then people come and go. But honestly, this group probably has helped, I can't tell you how many people through this process, and they also have fun.
I love that.
They have cocktails and all kinds of stuff. So death cafes differ across the spectrum. They're very relevant, and there's many of them on the East and West Coast, and they're just starting now to hit the middle of America. You know, we're always last to get all this stuff. And so we've found that that's been pretty meaningful as well, and we've had a lot of positive feedback about that. So that's another thing that we're doing. And I also want to say, as I said, I started out, we're doing a different workshop every month around this. And so we invite everyone to come to that. And we just ask, do you have any comments, any questions?